Welcome. Thank you for joining me. My name is Richard Sabel, and I'm a clinical assistant professor here at SUNY Downstate in the Occupational Therapy program. And I'll be talking to you about fall prevention, but specifically about occupational therapy's unique contribution. Each profession has its unique contribution, and I'd like to highlight, as we talk about fall prevention, some of the unique aspects of occupational therapy. Our objectives for today is at the conclusion of this session, hopefully, you will be able to discuss the key physical, behavioral, and environmental risk factors contributing to falls, that you'll also be able to apply specific interventions to address the identified physical, behavioral, and environmental risk factors, and also be able to explain occupational therapy's unique contribution. Let me just recommend that you keep your phone camera handy so that for certain slides, if you want, you could take a picture, because I'm not going to read everything on every slide, and this way you can capture it and use it and refer to it later. So the facts. We all know there's a burgeoning elderly population, the baby boomers, of which I'm a part, and the scary number is that 1 in 4 older adults fall each year. That's people 65 and older. But if you break it down to groups such as 75 and over and 85 and over, those numbers increase dramatically. And falls, unfortunately, are a leading cause of injury deaths among older adults. 40% who have a fall are more likely to fall again. And it impacts, when people fall, their mobility, their ability to do ADLs. And there's tremendous cost to the healthcare system. But there is good news, hence this presentation, that there's a lot we can do to prevent falls, and in that, reduce costs for the individual and, of course, society. So the major consequences of falls, just sort of a summary of that previous slide, is that when people fall, oftentimes there's a subsequent decline in their functional status. They don't get back to baseline, right? The burden of care goes up. For some, it can be nursing home placement. And a key factor, a huge factor, is that when someone falls, oftentimes they'll develop a fear of falling. And evidence shows that when somebody's fearful of falling, guess what? They're more likely to fall. So the issue is how the person's thinking. As is true for most things in life, how we think about an experience influences what that experience is like. So that if I have these more negative views of my ability to remain upright, then that fear can have a lot of negative consequences, not only putting me at the risk of a fall, but put me at risk for disengaging. So the point of view, does the person I'm working with see the glasses half empty or half full, right, can make a big difference in this situation. So as I mentioned, if there's a fear of falling, the person is more likely to disengage. So on this slide, you can see there's a circle, and there are 3 different numbers, 1, 2, 3, right? Look at number 1, that when someone's fearful and they start to do less, and they don't go out and engage as much, they live a more sedentary lifestyle, that change in behavior can contribute to weakness, right? They move more towards the couch potato end of the spectrum. And as they disengage, that means they're not socializing as much, they're not getting out in the community as much. And that can lead to dysphoria, sadness, or unresolved, it can lead to depression. And we all of us, in March of 2020, had a sampling of that, right? That we were restricted. We couldn't connect and be with the people we really loved and cared about. And we know the impact that many of us went through. Many of us felt sadness. Many of us were depressed because of that. And then go to the third point, that if I'm not moving as much and I'm getting weaker, feeling sadness, possibly depression, that can lead to a greater dependence on assistance. Again, the burden of care can go up. So this becomes, or can become, a vicious cycle. So a key piece in this, in the fall prevention program, is can we, without lecturing, but through the things that each of us do in our respective professions, begin to influence the person's thinking in terms of how they sense, feel, think, and act. So engagement. If the person's beginning to disengage, that really will have an impact, most likely, on their overall well-being. And here on the screen you see a study that was done. It's an older study, 1999, at the Harvard School of Public Health. They looked at about 2,800 older adults, split evenly between men and women, followed them for 13 years, and they looked at the mortality data. And here's what they found, that people, my language here is summarizing it, the people who remained engaged in activities that were either physically demanding or more sedentary lived longer, healthier lives. So if somebody loves stamp collecting and keeps doing it, somebody loves nice brisk walks in the park and other activities in the community, doesn't matter, but both types of engagement have tremendous value in the person's well-being. So it's really up to us, right, in terms of fall prevention. The ultimate goal is to help keep that person engaged, living their life, and doing the things that are meaningful to them. And connecting to that is our role in healthcare. So this book by Dr. Gawande, which came out about 10 years ago, feels like 3 or 4 to me, but 10 years ago, Being Mortal, that he wrote. Dr. Gawande is a surgeon and wrote this book partially about his experience with his own father as they were navigating the healthcare system. But I just want to talk specifically about a part of the book where Dr. Gawande, observes the chief geriatrician in the medical center that he was a part of. And he writes in the book about this one client that the geriatrician is working with. And the geriatrician starts to talk to this woman about a typical day in Great Deal, the things that she does. He doesn't focus on the medical issues much, of which there were numerous comorbidities that this particular woman was dealing with. And then he spent time looking at her feet. And when Dr. Gawande when the client left, and Dr. Gwande's talking to the geriatrician, he goes, "Why did you spend so much time looking at her feet?" And he said, "Well, it's a really good quick assessment. Because think about it, for any of us, if you have any issues with your feet, isn't that going to impact the quality of your life? Have you ever had a little pebble in your shoe, and how much did that impact your ability to walk around and do the things you wanted to do?" Because from the geriatrician's point of view, her biggest danger was losing what she had by falling. So his summary to Dr. Gawande was, rather than just health and survival, we need to enable function and well-being. We're focused on the disease, not the living, right? So what really becomes important here is that for all of us, certainly we have to address the medical issues. Why is the person here? But we have to balance that out with, of course, what's important to that person and how can I help them to remain engaged in the things that they care about. Directly related to that is helping that person stay in their own home. If we can do that, obviously lessens the cost to healthcare, the person's happier, and we're all familiar with the term aging in place, right? That when we survey older adults, a vast majority say they want to stay in their homes as long as we can. So a key piece in fall prevention, right, is can we help also not only address the physical, but can we also work with the person on the physical environments in which they live to help identify risk factors, things that put them at risk for fall, that make it harder for them to bathe or toilet, get in and out of bed, whatever the basics might be, make those modifications so that they can continue to function independently with these adaptations and modifications. Online, if you go to AARP, they have this wonderful home fit guide. It literally takes you through every room of a home, and they have, so you can download the guide, they have videos, worksheets, which are in a number of languages, and we can guide our clients to go there. We can print it out and supply it, provide it to them. And again, very helpful. And I'm going to talk more about environmental factors in just a little bit.